sorry. I thought I was going to X-ray school, not child psychology. But apparently, the ARRT wants you to know a little bit about pediatric behavior for your registry test. So I'm gonna go over some things about pediatric behavior that you might be tested on for X-ray school, okay? Let's break it down by age group because the ARRT loves this topic and we love the trauma. Infants, ages 0 to 1, the screaming potatoes. Little blobs of chaos, they do not act mature or predictable. They cry, they poop, and then they flail. That's it. No emotional complexity, just full-blown biological tantrum. The ART wants you to remember this. Use immobilizers. Warm your hands. Radiation protection is a must because the younger the cells, the more radiosensitive they are. Let's talk about toddlers, ages 1 through 3. Agents of anarchy. Drunks. Zero coordination, unpredictable speech, and they will fight you over a sticker. The ARRT wants you to know. They crave independence, but they have none. They'll scream just because they're bored. You better have a distraction ready, a stuffed animal, bubbles, or your soul for sale. Their tips, tell them what you're doing, don't ask. This is not a democracy, it's a radiographic dictatorship. Treat it as such. Young children, 4 to 11, the unpredictable chaos lords is the answer to your registry question. These kids are the emotional slot machines of radiography. 1 minute they're calmly holding their teddy and chatting about dinosaurs, and the next they're sobbing because you looked at them weird. Here's the key points. They can be mature or they can melt down. They're scared of pain, not necessarily radiation. Give them simple explanation. Offer choices so they feel in control. You want to hold the dinosaur or the astronaut during your x-ray? Teenagers, ages 12 through 17. Mocking eye rolls with iPhones. They'll ignore you, pretend they're not scared, then give you full-on attitude buffet when they have to remove their hoodie. ART wants you to treat them with respect, know that their privacy is sacred. They're very self-conscious. May understand your instructions, but don't expect them to admit it. And avoid condescending language. So teen mode, speak like a tech, not a parent, or they'll shut down harder than a DR panel with a full buffer. Okay, here's some other pediatric tidbits they might slip in for your test. ALARA is your pediatric mantra. Short exposure time, tight collimation, proper shielding. Patient ID, always double check patient ID with the parent plus the wristband if possible. Don't assume that just because the mom handed you the kid, that's the kid that you're actually x-raying. Immobilization, you better know about the Pegastat, sponges, tape, sandbags. Use parent help if allowed, but only after explaining what's happening and asking parents about pregnancy. And consent, minors need parental consent. Unless it's an emergency or an emancipation situation. But remember, teenagers still deserve an explanation and respect. In conclusion, infants cry, toddlers destroy, young children can give you whiplash, and teens will emotionally ghost you mid-exam. Know the ages, know the vibes. And for the love of all that is radiopaque, don't pick infants when the question screams emotional unpredictability. That's the 4 to 11 crew, baby. They're chaotic, confusing, and the exact reason that coffee exists. I would know. I own a nearly 4-year-old. Okay, bye.